Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will learn what Williams syndrome is, diagnosis, symptoms of Williams syndrome, risk factors, treatment options, and how Williams syndrome relates to epilepsy. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified about future videos. Please click on our donate link in the section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Williams syndrome, sometimes referred to as Williams-Burren syndrome, is a genetic disorder brought on by the absence of chromosome number 7 genes, a deletion that occurs during fetal development. This genetic mutation has been associated with the evolution of various abnormalities, including narrow blood vessels, high blood pressure, elevated blood calcium levels, and pronounced bodily features such as unusual teeth spacing, a small jaw, flexible joints, and short stature. This condition is also characterized by cardiovascular defects as well as developmental and social difficulties, which is highlighted by studies demonstrating that individuals with Williams syndrome have a hard time appropriately engaging in social interaction. Genetic testing, an echocardiogram, and blood testing can be used to identify gene and cardiac abnormalities in suspected Williams syndrome populations. However, other neurodevelopmental disorders, such as fetal alcohol syndrome or DiGeorge syndrome, should be considered as differential diagnosis. People with Williams syndrome may experience a diversity of symptoms, including learning and intellectual disability, farsightedness, and musculoskeletal abnormalities. In terms of mental capacities, noticeable impairments in visual motor skills, high levels of non-social anxiety, the presence of phobias, and a shorter attention span are recurrent characteristics in affected individuals. A study examining the behavior of institutionalized children suggests that individuals with Williams syndrome present distinctive social, emotional, and behavioral features. Hypersociality, excessive empathy, and social inhibition are frequently observed in individuals with this condition, with a smaller subset engaging in autism spectrum disorder-related behaviors to boot. Williams syndrome is unpreventable. The genetic change that engenders this condition is either inherited from one of the fetus's parents or spontaneously develops in utero. The likelihood of inheriting this disorder when a carrier is affected by this mutation is 50%. Individuals who present a combination of intellectual disability, poor visuospatial construction, cardiovascular difficulties, and physical abnormalities in terms of growth and faces are more likely to be suspected of having Williams syndrome. There is no cure for Williams syndrome. Instead, early intervention programs and various forms of therapy are used to improve specific skills such as verbal or developmental abilities. Individualized behavioral counseling and medication can be prescribed for individuals with comorbid attention deficit hyperactivity disorder and anxiety, but these treatment options remain management-based. For heart and blood pressure related symptoms, consulting a specialist in order to target an appropriate treatment is recommended. Epilepsy has been identified as a minor feature of Williams syndrome. However, with only a few cases having been reported, researchers can only hypothesize that an undocumented metabolic disturbance could be a plausible sense of seizure onset in study participants. Antonell and colleagues also suggest that deletions of specific Williams syndrome region genes might be responsible for the neurological impairments observed in afflicted people. In fact, variants of the GTF 2IRD1 gene, specifically have been cited in cases of Williams syndrome, paired with comorbid epilepsy and autistic traits, but further research is needed in order to draw more conclusive results. In conclusion, Williams syndrome is a condition marked by behavioral, physical, and internal abnormalities due to genetic mutation. As of now, few studies have explored its direct association with epilepsy, but research hints at an underlying genetic basis for epileptiform activity in the chromosome 7 region. To learn more about Williams syndrome, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.